Yeah, testosterone, obviously, for most males, the big thing is they want an erection, and they want to have a libido, a strong libido, because men, as a man, I know men are very simple, very visual, and they thrive on that part of their being. And when you lose that, when testosterone goes down, it can be disconcerting for some males. And testosterone actually will help your libido, your thoughts of sex, your fantasies. It really does all this stuff. It increases all of that. Strength of erections, size of erections, how long you're lasting. Yeah, it's not only for that, that energy boost and that libido and that feel good thing. It's also for health. There'll be more studies and studies coming out, because there's a lot of testosterone being given right now. So there'll be more and more information out there in the next several years to prove this. As we get past 50, you'll start to notice that a lot of people have dwindling testosterone levels. Our testosterone replacement program is unique in that we take people individually. We work through them and we follow them over a long period of time to keep them safe. We offer different ways of delivering the testosterone depending on the patient's needs. I spent 20 years in emergency medicine. I was board certified in emergency medicine. Got introduced to nutritional and metabolic medicine and entered a fellowship and realized that there's so many new things out there, not just testosterone replacement, but there are a lot of more natural ways to deal with aging, diseases, inflammation, autoimmune diseases, and we do that also here in addition to the testosterone replacement. Most men in their 40s and above usually start to have symptoms of testosterone deficiency, but there are some younger people that will need it, that are under high stress or have other issues that are causing low testosterone, but mostly it's the older population. The usual symptoms that you see most commonly in males are, of course, the low libido. That's one everybody always thinks about. But there are other things that are less obvious to people, are depression, a lack of energy, decreased strength, irritability, anxious. All those things can be due to testosterone. Of course, there's other causes, but that's what most physicians don't look for, is a testosterone cause. And just checking a testosterone level and then replacing it and see if they actually improve with their energy and their tiredness and all these kind of nebulous symptoms. As a matter of fact, in the American Urologic Association, there's been recent guidelines that have come out that say if your testosterone is low, you have increased morbidity. Things like cardiovascular disease, prostate cancer, diabetes. Now they're saying that you're at risk if it's low. So to me, that means you don't want it to be low. Low testosterone is associated with increased chance of death. So to me, that means let's get it to the right level. Let's not overshoot it. Let's keep it in a nice, safe level for you. There are multiple ways to replace testosterone. Creams are when you just put creams on daily and they're absorbed through your skin. They don't absorb as well. Injections, which are twice a week or once a week, which is just an intramuscular injection, which we do here. There's also pellets, where you put a small pellet underneath the skin and it lasts for 3 months, and this seems to be the most efficient delivery and the most steady state of levels of testosterone. Yes, any physician can prescribe testosterone. But it also has to be followed very safely. You have to check blood levels, and you have to make sure the patient doesn't have increasing levels that can cause some side effects that we need to watch over time, and you just can't give it blindly. Things like that you just have on the regular market are testosterone boosters, and some of those have mixed results. You're not really going to get large increases in testosterone to keep you at a physiological normal level, whereas our program, we try to get people into a certain range. We're not seeking to give them the bodybuilder's range, we're trying to keep you in a range where it's physiologic, like you were when you were younger. At Quantum Health and Wellness Center, we believe in optimizing the whole health, and we also, testosterone is part of that for males in a big way. also females, but more so in males. And we do it in a safe, effective manner, and we integrate that with other parts of your health. Come on in for a free consult, and we'll check your levels. And if they're abnormal or low, we can talk about how to increase those levels and do it in a safe and protected manner